Hello, good evening. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our clinic this evening. If today is the first day attending my open clinic in YouTube, I truly appreciate the moment you brought out to spend a few minutes with me. Now, today's clinic will be in continuation to the celebration today. Today is World Mental Health Day celebration. So today we're going to talk about the impact of infertility management on your mental health, how infertility treatment, management, changes, adaptation can affect your mental health as a woman and your mental health as a man. Very important topic. Now, I want to tell you something you need to remember. Life can be hard. We understand that. Life can be challenging. We understand that. Life can be difficult. We understand that. If you are hearing my voice this evening, you are tougher than all your challenges. So if you were able to overcome all those mental health problems that nobody even felt you had, but you fought it alone, it's no longer ideal to just be by yourself. It's about time you get help. You can always get help. It's important to understand the impact of infertility itself and the impact of infertility treatment and management in your mental health. They can affect each other. Infertility can impact your mental health. Your mental health can impact the outcome of your infertility management. But at the end of the day, the common denominator is victory. So I see you overcoming all the challenges you're having. I see you overcoming your primary infertility, your secondary infertility, your male infertility, your female infertility, and succeeding in flipping the odds. So please make yourself comfortable. Also share this link if you have anybody out there you genuinely want to, plead for. If you have a relative who you know fully well will benefit from today's event, please copy the link and share on your timeline. If they are not able to attend in person, after this presentation, we'll also have a repeat one in our Facebook. Now, taking care of your mental health during your fertility treatment, it's one of the most important things you can do as a couple. Now, a couple that work together as a team will overcome anything, will overcome everything. But when you're isolated, when you're not in a good place and your partner is not connecting with you, it can aggravate the ongoing infertility. It can actually make it worse. It can bring more divide. So a problem you guys can use 6 months to solve, you might end up spending 6 years solving the problem because you guys are not understanding each other. Now, according to a recent study, fertility concerns can create a tremendous amount of stress, of anxiety, of depression in your relationship. So prior to succeeding in starting your family, there are some couples that were definitely in love, Romeo and Juliet. But just few years into the relationship, no babies, and everything begins to fall apart. The man is going south, the woman is going west. They are not on the same page. So when you handle the psychological aspect of stress, anxiety related to the unknown future, so you don't really know when it's going to end. So you don't really, you've developed chronic stress. Your relationship is strained. You don't have that chemistry. You're no longer connecting. The libido is gone. You no longer talk. You wake up in the morning, you're basking in your stress, you're basking in your anxiety, you're basking in your depression, you're basking in your irritability. You don't communicate. A lot of things are going on the inside. Then on top of that, majority of the fertility drugs they will use to manage your infertility, some of them are hormonal based and they can actually alter your mood. So there are some fertility drugs we will give you. You begin to experience this isolated, low feeling. And unfortunately, some of them can further depress an ongoing depressed mood. So imagine you being mildly depressed, then you take a couple of hormonal medications, and also due to your lifestyle, you will further sink. So depression is like a sinking sand. So depression can be mild, it can be moderate, it can be severe. So majority of women that go through infertility, the reason why I'm talking more about women is because women tend to experience more emotions compared to men, outward emotions. So infertility affects millions of individuals out there. And infertility can strain your relationship. It can bring a lot of negatives. It can make you feel like you're not worthy. It will make you feel like you're not yourself. You have a deep feeling of grief. You have a deep feeling of loss. Like if you have miscarriage, if you have stillbirth, if you have anything that didn't end the way you planned it, you just don't feel yourself. And unfortunately, there are so many, incompatible relationships out there. Probably you married her because she's beautiful. Probably you married him because he's got money or he's handsome. Then suddenly everybody is equal. That money is no longer a factor. You might have all the money in the world. You might have all the cars in the world. You might live in the choicest place in the world, but you don't have one thing you desire, that baby. And the man might be so busy using work to block his emotions. He's not expressing his emotions. He's out, you're back, you're crying, you're not sleeping. You keep comparing yourself with other people. You are not going crazy. These are normal emotions that infertility routes can bring up. But guess what? It's a journey. Infertility is a journey. You will eventually end your journey. It's not a dash. So you might not have any baby in 2023, and in 2024, you can have 4 babies. So it's not the end. It's just the beginning. And it's a challenge. It's something that is transient over time. You're going to overcome. So for some women and couples, they can have a lot of expectations. I want to have 4 kids. I want to have 3 girls. I want to have 4 boys. And suddenly you're looking at those expectations. You're looking at those plans, those dreams. You wanted to do this. You wanted to do that. It feels like your dream has been robbed. In 2021, they took a sample of 200 couples that visited the clinic. And they noticed that half of the women that actually passed through that clinic, both the women that succeeded and the women that did succeed, developed some medical problems, developed some mental health problems. So today, even men are getting involved in managing infertility. So men can also feel the same emotion. So the idea is to understand that some of those drugs can actually alter your mood. So most of the drugs we're going to use are hormone replacement therapy. For example, we can give you artificial estrogen, artificial progesterone, artificial FSH, artificial gonadotropins. What they will do, naturally, you're not supposed to have anything artificial. Your body already got what your body needs. But when we begin to alter, sometimes we can tilt a little bit on the left, sometimes we can tilt a little bit on the right, while things are done the right way. So the hormonal drugs will help you to have ovulation induction. Hormonal drugs will help you to take in the endometrium. Hormonal drugs can solve some gynecological problems, but they might have side effects. Some of them can affect your mood. Some of them can affect your sleep. Some of them can make you to be more anxious. Some of them can make you to be more irritable, just for a little while. Now, if you don't have a support system, the time you're going through all this, it can mess things up. It can make it more complicated. So I'm going to mention a couple of emotions attached to fertility itself and also attached to the fertility management. So fertility management, both IVF, IUI, and all the other types of fertility management, they can come with a lot of stress. They can come with a lot of anxiety. They can knock you into depression. They can lead you to insomnia. And once you have this, for men, they might tend to, go for alcohol, or they might tend to be binging, or they might tend to find things to replace that their anxiety, that their depression. And in course of doing that, they will make it worse. So imagine a man that has low sperm count, who ordinarily should not be drinking, but it's weekend. He's just finished watching his soccer. The wife is upstairs, not in a good place, probably in her room, crying, feeling down, and he's done with his soccer. What's the next thing to do? He's going to go hang out with friends. What happens when men hang out? They eat nkwobi, they drink alcohol, they eat stuff they're not supposed to do. They just stay in one place. It's not exercised. So it will further make it worse. A man that has low sperm count, poor motility, poor morphology, doesn't have any business with alcohol. But that alcohol is the only thing that gives him that temporal relief. So the first emotion you may have if you're currently going through infertility and if you're currently going through drug management or any type of therapy is depression. So depression is not just about feeling sad or down. Depression is a mental health condition that you will experience a persistent, so the keyword is persistent, severe low mood. So you're caught up in the ups and downs of infertility. It can knock you into depression. Just make sure you avail yourself of consultation with your doctor so we can serve you a basic tool. You don't just stay back and say, I'm depressed. So majority of people that say they're depressed, they're not depressed. There's a particular questionnaire we're going to serve you. There are particular questions we can ask you and we can determine if you have mild depression, moderate depression, or severe depression, and we manage it appropriately. Majority of women that go through fertility treatment will also have anxiety. So anxiety is a feeling of an overwhelming dread. You're thinking about things that won't even happen. And when you have this anxiety, it's not going to help you to deal with worry. 24 hours, once you wake up in the morning, you are messed up. You are all nerves. You can't drive. Everything is all hazy. Everything is all messed up. You can have acute anxiety disorder. So you worry more about things that you're not even supposed to worry. Anytime your period is going to come, or your period is not coming, you're freaking out, you've already started IVF and everything is going okay, but you don't see the good end of your procedure because your nerves have been taken all over the place because of your adrenaline, your stress hormones, everything is up. So people that go through fertility management, especially IVF, they tend to develop a lot of anxiety. But if you have a good partner, and if you have a good doctor will take your hand and it will assure you that will go above and beyond to help you understand things better. When people have failures in their IVF, in their IUR, in their pregnancy quest, it hurts so bad. It feels like a gross, loss. The sense of grief is indescribable. It's a genuine feeling. Don't discountenance it. Make sure you express all those negative and positive feelings. There are some people that will have miscarriage, you will see them laughing. That laughter is the opposite of what they are feeling on the inside. There are some people that might be crying and it might be the opposite. So people respond to things differently. Now, majority of women will also be irritable. Irritability is very pronounced on a good day. Women go through a lot of emotions in a month. So when you're having your period, you notice you're more irritable. When you're ovulating, you notice you're more irritable. How much more when you're not having what you've always wanted to desire, your baby. So during fertility treatment, you tend to always be irritable and angry. It's not that you're going crazy. It's part of your emotions. So medical procedure can leave you feeling vulnerable, exposed, helpless. When some women don't like, exposing their body. Some women don't like going to the hospital. When they go to the hospital, they feel they no longer own their body. Their body is exposed. They're so helpless because they're looking for babies. They are all genuine feelings. They are all genuine mental health problems. Jealousy. I know some people will criticize this. Oh, why will you be jealous? Jealousy is a natural but infantile feeling. So you may feel like life is not fair. You might be the elder sister and all your younger sisters, they've all completed their family and you're married late. So you begin to compare yourself with other people, including the people you love. Jealousy is not to strangers. Most jealousy are to people we love. You can even be jealous of your spouse. Your spouse can be jealous of you, your siblings, your colleagues, people that are very close to you. That's actually where you can feel the sense of jealousy, especially when you see their babies. They are all genuine. So you feel like life is not fair. You feel like, the milestone other people are reaching, you're not reaching your own. So what's different? Jealousy is a very painful emotion, but it's also a helpful thing that will guide you in the right direction. So you will know that definitely what's going to make you happy is not money. What's going to make you happy is not car. It's your baby. So you put in more efforts in getting those things that will make you to be jealous of other people. Now, of course, I've already mentioned grief. There are so many couples that feel like the world has collapsed because of failure of infertility to be resolved, failure of a particular, treatment, IVF. You spend a lot of money and it failed. Some people have experienced extreme grief to the point of suicidal tendencies when IVF fails. They mourn the loss like someone genuinely died, and it's a true emotion. So if you happen to find yourself in this type of emotions, don't bottle it up. Just seek professional help. Majority of spouses going through fertility treatment will feel isolated. They're throwing a party, you don't feel like going. They're going for Thanksgiving, you don't feel like going. It's Sunday, you'll be like, what am I going to church for? Why will God not answer me? So you feel isolated. So fertility treatment and the feeling of depression, anxiety, irritability, jealousy can box you up. You used to be a social butterfly, but lately you just feel alone and isolated. They are all part of the journey. Thankfully, it's a temporal journey. So while you're receiving the fertility treatment, you might feel some intense feeling that everybody is avoiding you, everybody is talking about you. You no longer behave the way you used to behave. It's a transient thing you will overcome. Unfortunately, some of the medications you're taking will make it worse. Now, generally, these are the known feelings you will have. Now, I'm gonna end by telling you what you should never tell anybody going through infertility, especially people from developing countries. We are very fond of being judgmental. We are very fond of being overtly too religious. We are very fond of writing people up. We are very fond of giving the wrong advice. Our utterances must be well guarded. If you go to someone going through intense grief, miscarriage, stillbirth, death of a baby, long-term infertility, don't tell them, enjoy this time. Trying is the fun part. Never use such. Don't use just relax, it will happen. Don't say such. Don't use everything happens for a reason. That's actually the worst. Don't use if you have more faith in God, it will happen. This is crazy. You don't say that, no matter who you are, not even a pastor. So don't say enjoy this time. Trying is the fun part of it. Never say that. That's very mean. Don't say relax, it will happen. There is no relaxation in telling a woman that recently didn't get the result she wanted. Don't use that. Don't say, oh, if you have more faith, you're just being purely judgmental. God didn't allow other people to have babies before you because they're better than you. No, it's called grace. Don't use at least you know you can get pregnant after miscarriage. You don't use such. Unfortunately, we are living in a society where so many even caregivers will tell you this. Anybody using all these phrases for you is not helping you. It's making it worse. So instead, there are a couple of things you can say. You can say things like, infertility is so challenging. Do you want to talk about it? Let them lead the talk. Don't go to your friend that is going through a lot of stuff and you begin to talk like parrots or like a drunken sailor. Don't do that. Allow them lead the talk. Wherever they want to go, follow them. Use, I wish you didn't have to go through this. Beautiful. You see these phrases? It does magic. Use, how are you doing? I'm always here for you. If that's the only thing you've communicated to your friend currently going through tough time, you love that person. This is not a time of talking too much. This is not a time of thinking you know it all because you have 4 babies at home. Then you believe you're the person to advise. Don't use all those words. Don't go for word salad. You can say, I'm so sorry for your loss. I'm bringing you dinner over. Find things you can do to alleviate their immediate pain. Sometimes you even go there, you say nothing. You just watch their countenance. Being there can mean a lot. Sometimes you say the best when you say nothing at all. So you can always say nothing and hug them and listen. Is enough than going there and messing things up with your too much knowledge. So that's my presentation. I hope I've helped you to understand this. If you happen to have gone through any of these emotions I've mentioned, understand it's genuine. What you need to do is to understand the transition point when you need to go and seek help. I'm going to open the clinic now, and we have just about 2 minutes. So please, if you have 2 minutes, if you have any questions, please quickly ask. Immediately after this clinic, I'm going to go to Facebook, and we're going to repeat the same clinic. So please, the clinic is over. Start asking your questions. COO, I can see you. I'm anticipating at least 2 solid questions from you. Tosi, thank you so much. Mahaneli, guys, let's use the next 2 minutes to ask questions so we can end a beautiful day today. Guys, ask your questions, please, quickly. My next clinic in YouTube will be on Saturday, 8:30 p.m. Nigerian time, 3:30 p.m. Eastern time. So please ask your questions. Once it's 20 minutes, if we don't have any questions, we're going to exit so I can get ready for my Facebook broadcast. But if you have any questions, please feel free. Remember the big event coming up on the 29th, Combined Fertility and Pregnancy Masterclass. You don't want to miss this. I'm so convinced that 2023 is the last year you're going to have infertility. I'm so convinced, I have implicit confidence in God that by this time in 2024, you will dance. You will stay up to breastfeed your baby. I'm so convinced. I am not moved. I don't care how long it's been. I know that it's going to come to an end. This is the moment you've been waiting for. Will infertility-related mental health issues go away after childbirth? Yes. Some of them, majority of them are transient. With the coming of your baby will come with good fortunes. You see, pretty much everything I've mentioned, they will fizzle out. But here's the deal. Having babies is not for the faint-hearted. Even a new mother can be overwhelmed. So there are things that can happen to you after birth. For example, you can develop maternal blues. You can even develop maternal depression, or you can even develop postpartum psychosis. So it depends on your social capital. It depends on your support system. But if you had infertility for 15 years and you succeeded in defeating infertility, nothing else matters. If you're staying up and the reason why you're staying up is to breastfeed your baby, everything becomes normal. Babies change everything for good. You will no longer feel pain. Babies are the best anesthesia you can have ever. Admin, capture that for me. The biggest thing that will take and numb your pain away permanently are your babies. I will tell you guys a true life experience. When I was practicing in Nigeria, for all the women, I gave episiotomy. So episiotomy is a surgical cut we normally give women that are about to have their babies, especially if it's their first babies. So we will normally give episiotomy surgically to create more room so the baby will come out. Of all the women I administered episiotomy to, you see all those painkillers we give before we give it. They don't even care. They are focusing on hearing the voice of their baby. So that time we are cutting and all those bleeding there, they don't just care. So there's a point in life your pain will vanish. And that point is when you behold your baby. Nothing else matters. Absolutely nothing. So majority of your depression, anxiety, irritability, jealousy, they will fizzle out. You will feel like you've accomplished something. You will applaud yourself. These are the positive things that will come when you have your baby. Okay? What are the things that can help someone overcome infertility worries on a daily basis? Actually, that's the bulk of what I taught about today. Communication, expressing your feelings, seeking professional help, getting information, knowing exactly how to think outside the box, eating good food, making sure you sleep properly, exercising, having good talk with your partner, seeking professional help. These are basic baby steps that can help you to overcome while you're on the journey of infertility. Of course, you know that majority of the women will be the ones that will be worried, but your male partner can contribute to your mental health 100% if he's giving you the support. Generally, there are some mornings you will wake up and your woman will be in a bad mood. You just don't know what women are going through. If you have a husband that understands that your mood can suddenly change, that's a plus. You will deal with whatever problems you have better. But if you have a husband that is always pissed whenever your mood and all those things switch, then you have a problem. So your support system is very important. This is why once you succeed in having a baby, your mothers will come for Mugo. Your mothers are coming to help you because having a baby is not for the faint-hearted. Having just one sleepless night. There are some women that when they have their babies, they will have a strong dislike, a strong hatred, a strong deadly feeling against the baby they've always wanted to have. Now tell me, how can a new mother have strong negative feeling about the baby? It's a mental health problem. Is a disease condition. There is no normal mother that will have psychosis, that will be so depressed to think about harming the baby. It's a medical problem. So when you notice such, seek for help for them. Never criticize them. Okay? So I believe that's just about the only few questions we have. So thank you so much. This particular teaching today is very important to this community. Unfortunately, only few people attended this clinic. I want you to do me a favor. Copy the link to this video, share it in all your handles in social media. It's going to help someone to bounce back. So thank you so much. Please join me to our Facebook if you have that moment, and we continue the conversation. Until I see you guys on Saturday, God bless you and bye-bye for now.